You're home alone. Your chest tightens. The room begins to spin. Your heart feels heavy, but no one is there to help. What do you do? If you're over 60, this scenario isn't just terrifying, it's real. Every year, thousands of seniors suffer silent, deadly heart attacks with no one around. But knowing a few powerful steps, just 60 seconds ahead of time, can change everything. This isn't about fear. It's about readiness. And it might just save your life, or the life of someone you love. 1. Immediate danger and urgency. Call emergency services immediately, don't wait. A heart attack can strike without warning, and when it does, every second matters. The most important action you can take is to call emergency services. Dial 911 or your local emergency number immediately. Many seniors make the dangerous mistake of waiting to see if it goes away, hoping the discomfort will pass. But heart muscle begins to die within minutes of blocked blood flow, and the longer you wait, the more damage is done, some of it irreversible. Paramedics are trained to begin life-saving interventions before you even reach the hospital. They carry oxygen, medications, and defibrillators that could mean the difference between life and death. Don't worry about being wrong. Even if it turns out to be indigestion or anxiety, it's always better to be safe. Heart attacks can come on quietly, especially in older adults, and you may not get a second chance. Make the call, speak clearly, and stay on the line. Help is on the way, and that one call might just save your life. Know the symptoms that are not always obvious. When people think of a heart attack, they usually picture someone clutching their chest and falling to the ground. But in reality, especially for seniors, symptoms can be much more subtle and dangerously easy to ignore. In fact, many older adults don't experience the classic, crushing chest pain. Instead, they may feel a strange tightness, a dull ache in the jaw or back, or sudden fatigue that seems to come out of nowhere. Others might notice lightheadedness, cold sweats, nausea, or shortness of breath even while resting. Women and individuals over 60 are more likely to experience these non-traditional symptoms. That's why it's so important to listen to your body and trust your instincts. If something feels off, don't dismiss it or assume it's just aging or anxiety. These quiet warning signs can be the heart's cry for help. The sooner you recognize the symptoms, no matter how mild, the sooner you can act. Being aware of the full range of symptoms could be the key to surviving a heart attack, especially when you're alone. Chew a 325 mg aspirin immediately. If you suspect you're having a heart attack, chewing a regular strength aspirin, 325 mg, can be one of the most powerful steps you take to survive. Aspirin works by thinning your blood and slowing the growth of the clot that may be blocking blood flow to your heart. But timing is everything. The moment you feel symptoms like chest discomfort, jaw pain, or shortness of breath, reach for a non-coated aspirin and chew it, rather than swallowing it whole. Chewing allows the medication to enter your bloodstream more rapidly through the tissues in your mouth, giving your heart a better chance to keep beating while help is on the way. It's important to note, do not take aspirin if you're allergic to it or if a doctor has specifically advised against it due to other health issues. But for most seniors, it's a life-saving measure that can reduce the severity of a heart attack. Keep aspirin tablets in your emergency kit, your nightstand, or a pillbox near your chair. It's a small pill, but it can make a life or death difference. 2. Escalating tension. The "what if you're alone" scenario. Unlock your front door and sit near it. If you've called for emergency help and you're alone, the next step is simple, but could save your life. Unlock your front door immediately. Paramedics may arrive quickly, but if they can't get inside, precious time could be lost breaking in or waiting for assistance. In the event you collapse or lose consciousness, they must be able to access you without delay. If possible, also turn on an exterior light or leave a note on the door indicating you're inside and need help. Once the door is unlocked, position yourself near the entrance, preferably sitting upright or reclining slightly in a chair close by. Avoid lying flat, which can make breathing harder and increase strain on your heart. Being near the door gives responders faster access and allows them to begin treatment without searching the home. If you live in an apartment or use a security gate, consider giving trusted neighbors or emergency responders the access code. Taking this step shows you're thinking ahead, and could mean those crucial seconds are spent saving your life, not breaking down a door. Stay calm and sit upright or recline slightly. When you're having a heart attack, your body's natural response is panic. But panic is exactly what you must avoid. Fear and anxiety increase your heart rate and blood pressure, placing even more strain on an already struggling heart. That's why one of the most life-saving things you can do in those first critical minutes is to stay as calm as possible and position yourself correctly. Don't lie completely flat, as that can restrict breathing. Instead, sit upright or recline at a 45-degree angle, preferably in a sturdy chair or propped against cushions. This position helps ease the heart's workload and improves oxygen flow to the lungs and brain. Begin taking slow, deep breaths. Inhale through the nose for 4 seconds, hold for 7, and exhale through the mouth for 8. This calming rhythm can stabilize your nervous system and reduce stress hormones that might worsen the attack. Remember, your mental state directly affects your survival chances. Keeping a clear head, staying still, and breathing steadily might sound simple, but they give your heart the best fighting chance to survive until help arrives. Avoid physical strain once symptoms begin. If you start experiencing heart attack symptoms, your instinct might be to walk it off, finish a chore, or get up and move around for help. But doing so can be incredibly dangerous. The moment symptoms begin, stop what you're doing and sit down immediately. Physical exertion places tremendous strain on a heart that is already struggling to get blood and oxygen. Even small actions like climbing stairs or pacing the room can increase the risk of cardiac arrest. Your priority now is to conserve every bit of energy and allow your heart to do the bare minimum until professional help arrives. Movement increases your body's oxygen demands, and during a heart attack, oxygen delivery is already impaired. That added strain could lead to collapse, arrhythmia, or unconsciousness. Instead, remain seated, breathe slowly, and keep calm. If you need to reach something critical, move carefully and deliberately, but only if absolutely necessary. Every heartbeat counts, and every ounce of energy you save gives your heart a better chance at survival. Stillness is strength when facing a heart attack alone. 3. Safety net. Tools and habits that save lives. Use a medical alert system, wear it daily. When you're over 60 and living alone, even part-time, a medical alert system can be the difference between life and death during a heart attack. These devices, worn as pendants or wristbands, allow you to press one button to instantly call for help, even if you're unable to reach your phone. Many systems now come with fall detection and heart rate monitoring, meaning they can call emergency services automatically if you pass out or experience a dangerous event. The most important part? You must wear it every day. Keep it on even while bathing or sleeping, since heart attacks often occur at night or early in the morning. Don't leave it on a nightstand or dresser where you can't reach it when you need it most. Seniors often hesitate to use these devices out of pride or fear of looking weak, but they're actually a sign of strength and self-respect. You're not admitting defeat, you're making a smart, life-preserving choice. Investing in a medical alert system is like keeping a personal paramedic within arm's reach at all times. Keep a heart emergency kit nearby. During a heart attack, even a few seconds can make the difference between survival and tragedy. That's why having a heart emergency kit readily available is one of the smartest decisions a senior can make. This small but powerful kit should contain everything you need to respond swiftly if symptoms strike, especially when you're alone. What should it include? Start with a bottle of non-coated 325 mg aspirin, which you can chew immediately. Add your nitroglycerin tablets if prescribed, a current list of medications, any known allergies, a copy of your medical history, and emergency contact numbers. Include a medical alert card with your name, blood type, and physician's info. Place the kit in multiple easy-to-access locations, your nightstand, living room, kitchen, and even a small version in your purse or pocket. In a crisis, confusion is your enemy. Having all your vital information and medication in one place ensures you can take action quickly and that emergency responders can provide proper care without delay. This kit is more than a bag, it's your backup plan, your lifeline, and your peace of mind. Keep emergency numbers on speed dial. When you're having a heart attack, you may only have seconds of clarity and coordination. That's why keeping your most important emergency contacts on speed dial is essential. In a crisis, you don't want to scroll through your phone or fumble to remember a phone number. Pre-program numbers like 911, your closest family member, your primary care doctor, and a trusted neighbor or friend. Label them clearly. For example, emergency, son, Dr. Lee, cardiologist, or neighbor, Mary Apt 2A. Place these contacts in your phone's favorites or assign them to speed dial keys so they can be reached with a single button press. Some smartphones also allow you to add ICE, in case of emergency, contacts to your lock screen, which first responders will check for fast access to your medical history and family notifications. This simple preparation means that even in a moment of panic, confusion, or physical weakness, you won't waste precious time. When every second counts, being able to call the right person instantly could make all the difference between life and loss. 4. Confidence builders. Know what to do. Know your heart medications and take them correctly. If you're over 60 and have a heart condition, chances are you've been prescribed medications like nitroglycerin, beta blockers, or blood thinners. But here's the critical part. In an emergency, it's not just about having the medication, it's about knowing how and when to take it. Let's take nitroglycerin, for example. If chest pain starts, you're usually instructed to place one tablet under your tongue and wait 5 minutes. If the pain doesn't stop, you can take a second dose, but no more than 3 doses total in 15 minutes. Improper use can be dangerous. For instance, combining nitroglycerin with certain medications, like erectile dysfunction drugs, can cause a life-threatening drop in blood pressure. That's why it's vital to understand what each medication does, what it interacts with, and what to do in an emergency. Keep an updated medication list in your wallet and emergency kit. If you're unsure about how to use any heart-related drug during a crisis, ask your doctor to walk you through it. When seconds count, confidence in your medication could be the lifeline that saves you. Inform someone you trust if you feel off. Many heart attacks start not with intense pain but with a vague, unsettling feeling, what some seniors describe as simply feeling off. It might be unexplained fatigue, a sense of unease, shortness of breath, or even lightheadedness that creeps in over time. Never ignore these subtle signs, especially if you have risk factors like high blood pressure, diabetes, or a history of heart issues. If something feels wrong and you're unsure, don't wait it out in silence. Text, call, or speak to someone you trust immediately. Say exactly what you're feeling and ask them to check in with you or stay on the line. Even if it turns out to be nothing, it's better to have someone aware of your condition in case things worsen quickly. Many lives could be saved if seniors simply spoke up when their body whispered the first warning. Pride, embarrassment, or fear of bothering others must never outweigh your safety. Remember, you're not being dramatic, you're being proactive. When you trust your instincts and reach out, you give yourself a fighting chance to survive and recover. Update your ICE, in case of emergency, contact info. In a medical emergency like a heart attack, you may be unconscious or unable to speak, but your phone can still speak for you. That's where your ICE, in case of emergency, contact comes in. Emergency responders are trained to look for this information on your phone, wallet card, or medical alert system. Having accurate, up-to-date ICE details could save your life when seconds count. Make sure your phone has at least one ICE contact saved under that label. For example, ICE, daughter Sarah, or ICE, husband John. Include their phone number, relationship, and note any key medical details, like allergies, diabetes, or pacemaker use. Most smartphones allow you to add emergency contact and health info that's accessible even when your phone is locked. Review and update this information every few months, especially after a medication change, surgery, or move. Also, ensure your ICE contact knows what to do, where your medications are, who your doctors are, and what steps to take if you're hospitalized. This quiet preparation ensures that even if you can't speak, your phone can advocate for you. 5. Calming the mind. Stay mentally in control. Practice controlled breathing or meditation. When a heart attack begins, your body enters a state of panic. Adrenaline surges, your pulse quickens, and anxiety skyrockets. While these are natural responses, they can make the heart attack worse by increasing the heart's workload. That's why it's crucial to use controlled breathing or meditation techniques to calm your system, even in the middle of a crisis. One powerful method is the 4-7-8 technique. Inhale slowly through your nose for 4 seconds, hold your breath for 7 seconds, then exhale gently through your mouth for 8 seconds. This rhythm triggers your parasympathetic nervous system, the part of your brain that tells your body it's safe to relax. Even a few minutes of this breathing can reduce anxiety, stabilize your blood pressure, and help your heart pump more efficiently. Seniors who practice meditation or slow breathing regularly often find it easier to access this calm state during emergencies. You don't need to be a yogi, just someone who values peace under pressure. When your heart is fighting to survive, giving it a calm, steady rhythm may be the greatest gift you can offer. Learn hands-only CPR. For helping others or yourself. You might think CPR is only something others can perform on you. But learning hands-only CPR could save someone else's life, and even empower you to survive a crisis yourself. While you can't perform full CPR on yourself, understanding the process gives you the confidence to stay calm, recognize signs of cardiac arrest versus a heart attack, and instruct others if they're helping you. Hands-only CPR is simple. If someone collapses and isn't breathing normally, call 911, then push hard and fast in the center of the chest. About 100 to 120 compressions per minute, roughly to the beat of the song, "Stay Alive." You don't need mouth to make a difference. Early chest compressions can double or even triple a person's chance of survival. For seniors living alone, teaching this to loved ones, neighbors, or caregivers is essential. You might be the one who needs it, or the one who gives it. Knowledge is power, and in this case, it's life-saving. Take a free CPR course online or at a local center. A few minutes of learning could mean decades more of living. CPR isn't just for others, it may give you the confidence to survive. 6. Don'ts. What to avoid at all costs. Don't drive yourself. One of the most dangerous decisions you can make during a heart attack is to get behind the wheel and try to drive yourself to the hospital. Many seniors, wanting to avoid causing a fuss or thinking they can get help faster on their own, make this mistake. But during a heart attack, your condition can worsen rapidly. You could lose consciousness, become disoriented, or experience sudden cardiac arrest, not just endangering your life, but putting others on the road at risk as well. The safest and smartest action is to call emergency services immediately. Paramedics are trained to begin treatment the moment they arrive, often administering oxygen, aspirin, or defibrillation right in your home or ambulance. These are life-saving interventions that can't happen in a car. Also, hospitals prioritize patients arriving by ambulance over walk-ins, meaning you'll get faster access to critical care. So resist the urge to tough it out or act independently. Don't gamble with your life. You need medical professionals at your side from the very first moment, not a steering wheel. Don't eat or drink anything. In the midst of a heart attack, it might seem harmless, even comforting, to sip some water or take a bite of something if you're feeling faint or nauseous. But this is actually one of the most dangerous things you can do. Do not eat or drink anything during a suspected heart attack unless specifically instructed by emergency personnel. Why? Because you may need emergency surgery, such as angioplasty or bypass surgery, and having food or liquid in your stomach increases the risk of complications during anesthesia, including choking or aspiration. Even medications taken with food could interfere with the actions of emergency drugs used by paramedics or hospital staff. Your body is already under severe stress, and digestion diverts blood away from the heart, which is already struggling. Water may also worsen nausea or vomiting, which are common during heart attacks. The safest move is to sit still, chew aspirin, if appropriate, and wait for emergency responders. Saving your life in this moment depends on minimizing all risks, and eating or drinking simply isn't worth it. Avoid cold showers or sudden temperature swings. It might surprise you, but sudden exposure to extreme cold, such as stepping into a cold shower or going outside on a chilly morning without warming up, can trigger a heart attack, especially in seniors. Why? Because cold temperatures cause your blood vessels to constrict, which increases blood pressure and forces your heart to work harder. If you're already vulnerable to cardiovascular issues, that extra strain could be the final push that sets off a life-threatening event. This becomes especially dangerous during or right after a heart attack. Many seniors, feeling overheated or panicked, might instinctively reach for a cold drink or splash cold water on their face, or worse, hop into a cold shower thinking it will help. In reality, the shock of cold can worsen the attack, potentially causing your heart rhythm to become unstable or your blood pressure to spike dangerously. Instead, stay warm and steady. Keep a blanket nearby and avoid temperature extremes. Dress in layers and avoid icy drafts or cold showers, especially in the morning when heart attacks are most common. Protecting your heart means protecting it from shocks, even environmental ones. Surviving a heart attack alone isn't about luck. It's about awareness, calm, and simple steps that prepare you before the unthinkable happens. Maybe this video won't just prepare you, maybe it will give you the courage to talk to someone, to check your emergency kit, to trust your body's signals. You are not fragile. You are resilient. And every moment you choose to prepare is a moment closer to staying here, for your family, for your friends, for yourself. You're not alone, even when you are. If this message touched you, please like, share it with someone you care about, and subscribe for more life-saving, heart-centered videos just like this. And if you have a story, a fear, or a word of encouragement, leave a comment below. Your voice could be the one that saves someone else's life.